Hello again, and welcome to another very dangerous episode of Forbidden Knowledge. My name is Craig, here to slap you around. I'm here to smack you in the jaw this time, actually, and I need everyone to record this program. You need to record this. You won't get this information anywhere else, and you won't get it in the first sitting. You're probably going to have to look over it again and again to understand fully. It's very advanced alternative health knowledge that probably affects everybody watching this, and you don't even know it, and your dentist doesn't even know it. You may have dental distress syndrome or faulty proprioceptive feedback to the brain. That's a long word. He'll fully describe it. Dr. Larry Lytle will fully describe what that is in the next hour. But here's some basics. If you take a piece of paper about an inch wide, put it in your mouth, bite down on it, just bite down on the back teeth only. Try not to just bite down normally. And if the strip comes out easily without tearing, you probably don't have the problem. But probably most of you it will get stuck, and that's probably because you have faulty proprioceptive feedback to the brain. You got a problem in your mandibular muscles and your vagus nerve, and you don't even know it. If you possibly have, listen to some of these symptoms. If you have persistent headaches or persistent neck, shoulder, or back pain, if you have postural changes such as one shoulder higher than the other, one leg shorter than the other, or the head tipping to one side. You may have endocrine disturbances or memory loss, clicking of the jaw joint, sensitive teeth, loss of hearing or ringing in the ears. You may have faulty proprioceptive feedback to the brain. You're actually cutting off circulation to your brain because of your jaw muscles, and it's all related to your entire body, folks, and your dentist doesn't know this, more than likely. Most dentists don't have a clue what this program is about, so tape this. Everybody's got to learn this information. If you stand in front of a mirror and one shoulder is higher than the other, you probably have faulty proprioceptive feedback to the brain. So gather this information, study it fully. It relates to the low-level laser, and I see this all the time when using the laser to people, and sometimes we get remarkable results just by relaxing the muscles in the jaw because they have faulty proprioceptive feedback to the brain. But I'll let Larry Lytle describe it fully because he's the expert. Thank you for watching this episode of Forbidden Knowledge. You're going to have to watch this over and over again, folks. Stay with it.
I wish there was a smaller word for this, proprioceptive feedback to the brain, and there isn't that I know of. But proprioception means receiving stimulation within the body's tissues. It's your body's sixth sense. It's a way of protecting itself in its environment. If I were to take my shoes off and walk barefoot on this carpet and step on broken glass, I lift my foot instantly. That's proprioception. If I reach over here and grab this electrical cord and it shocks me, I jerk my hand away. That's proprioception. You don't have to think, I'm getting shocked here, I'm stepping on something sharp. That's proprioception. But the main problem that we have in our country is that we know about proprioception in the chiropractic world mostly. The rest of the professionals don't know much about it. And the chiropractors know about it in the Golgi tendons in the feet, in the lower legs. But the most delicate proprioception in the entire body is between your upper and lower front teeth. And more recently, in the last few months, I've learned by putting that in research, they've done sensors in the first premolars. That's the teeth right behind your cuspids, your eye teeth. And they recorded a higher proprioception than the other lateral incisors. Just slightly, the eye tooth, not as high, lateral incisor, not as high, central's fairly high, and the first premolar, very high. Back molars less, so you can tell the difference in the thickness of an eyelash and an eyebrow when you put it between your front teeth. That's how delicate the proprioception, 1/1,000,000th of an inch. Now proprioception regulates significant portions of the brain. I'm not going to go into all the research on this, but the Chinese have known for a long time that what goes on in here regulates the meridian and the chakra system. It's only that this country has ignored it. This country ignored acupuncture until President Nixon went over there in what year that was, 68, and brought acupuncture back from China when he went over there on the open trade, and he brought acupuncture back and said, we ought to pay attention to this, and that's when acupuncture started being used in this country, even though it's been used in China for thousands of years. And our president actually at that time said we ought to do it. Well, now we have a lot of acupuncturists. Anybody in this room do acupuncture? Many times we have several people that are doing it. But acupuncture is regulated, according to Chinese, by the oral cavity. Now, not necessarily the teeth, Big mistake, folks, a big mistake, in that your holistic dentists believe it's the mercury in the teeth that regulates it. It is not. It is not your root canals. In fact, you can take the tooth out and you still have proprioception in the same spot. So consequently, it's the oral cavity that regulates proprioception, not necessarily the teeth in the oral cavity. But if the teeth are there, they play a role. But if the teeth are gone, you still have proprioception. It's almost like the what's the syndrome when you get your leg cut off and you still feel the pain? Phantom. It's almost like phantom pain syndrome. Even though there's no teeth in the mouth, you still have proprioception that regulates what I'm going to talk about now. Hans Selye, who was the father of stress, he was a medical doctor out of Canada, and most everything today that's written about stress was based upon his basic work. And Hans Selye wrote this preface to the book that was my teacher's book, Dental Distress Syndrome. This was the preface to it. And basically, he said that if dentistry and medicine doesn't get together, we're not going to get anything done that's good for the human body. Well, it's never happened. He died 3 months after he wrote this. So that's unfortunate. But he's considered the father of stress, and his book is, Dr. Fonda wrote a book, The Dental Physician, and another book, Dental Distress Syndrome. The Dental Distress Syndrome, the paperback, is out of print. I have all the rights to his work. I'm writing as rapidly as I can. And I will write a book on and update it on Dr. Fonder's work. But he has a book back there called The Dental Physician. Anybody that wants educational material to document what I'm talking about right now can get it out of The Dental Physician. It's the only place I know that it's condensed into a book form. Other places you got to bring it from different directions.
Can you repeat that?
The Dental Physician, just talk to Doug. It's right, you get it from Doug.
Thank you.
He's bringing one up and he'll hand it to you, Bill. Right there it is. Right here, Bill. That's the book. And that book is there's not many of those left. Dr. Fonder's deceased as well, and I bought, his wife may have a few, but unfortunately she's mentally in the state of Alzheimer's, and I'm not sure what she did with the books. It's pretty strange, you know, I mean, so I may have the last one of those available, but I can reprint them, but even reprinting that book there is a pricey deal. So it's it'll come maybe. But this is Hans Selye's work. I'm not into negative stuff, as you've learned all day. I try to keep in the positive mode. But I want to give you 3 studies that were done, and you won't find this study at Harvard anymore either. It's kind of like the frequencies that I told you on anthrax that I found on the website's gone. This is gone out of the Harvard Library. But I believe my teacher's Dr. Fonder, because I had a copy of it and saw a copy of it, but I can't find it at Harvard anymore. This concerns me when something comes out that seems to run cross-grain with what orthodox medicine, it disappears. Here was a study done. 33,000 medical practitioners, they were dentists and physicians, were studied why they died. Records were studied. Number 1 cause, heart disease and stroke. Number 2 cause, cancer. No different than what I put on the board this morning, and no different than what you see in the news. But when they started to evaluate the risk factors that our heart association says are risk factors connected with heart disease, they could not find any correlation between smoking, any correlation with obesity, high cholesterol, triglycerides. There was no lack of exercise. They could not find any correlative factors on 33,000 people other than the loss of 10 or more teeth. 10 or more teeth. It was a 66% chance of increasing your heart attack if you lost 10 or more teeth than if you did not. Okay, that study was repeated by my teacher, Dr. Fonder, And then he was lectured on it in Japan, and Dr. Koichi Miura said, I can study that. I don't believe that. I can study that, though. So he set out to study it, and he started out with beagle dogs, well, guinea pigs first, then beagle dogs, and then monkeys, and then humans. I saw the beagle dog one, and somebody was in my office last week, and I showed him the book of the dog that's, when they cut the teeth down on one side, the dog was unable to walk and its belly drug on the ground. Just could not walk. Just rendered it immobile by cutting the teeth out of bite, not cutting them off or making them painful, cutting them into the nerve, just out of bite. Then he did the same thing to monkeys, and this is what changed my dental career. When I saw the monkey study, I thought, wait a minute. We've got to get our head out of the sand here and take a look at what's real. They took 6 healthy monkeys, put them to sleep, took molds of their mouth, took blood studies, and they cut the teeth, shortened them up on one side, just shortened them up. Still there, but just shortened them up so there's space between them, but left the other side hit. When they came out of the anesthetic, they could not swing from the tree with that arm. They became angry with one another, their familial things, they fought, they went off of their diet, everything went bad. They then took those same monkeys and put them back to sleep and restored the amount of lost tooth that they cut off with restorative materials, and all of the symptoms reversed. Now that study was then taken, all the symptoms reversed. Now that study was then taken forward to humans. Dr. Miura, Osaka Medical Center, ran 100 medical tests. Now that's about every test you can possibly imagine. Eye-hand coordination, length of step, all the blood studies, blood gases, and about every darn thing you could measure. And then he put a 10 millimeter high piece of plastic in the back of in the mouth, on the back teeth only, and just a lingual piece of wire to hold it together from side to side. Anybody wear partial dentures or seen them, you know what I mean. That's called a lingual bar, and it holds them together. 10 millimeters high is a lot. You could stick your finger in the front. They wore that at night, and they put a 5 millimeter high one in the daytime. You could still stick a farmer's match between your front teeth with a 5 millimeter high. Wore it for 1 month. They brought them back, and 75 of the 100 tests were now 75% improved. Now, you stop and think about this a minute. You go to get a test, and your doctor says your tests are bad. Your tests show diabetes. Your tests show you got liver enzymes off. You might be having a heart attack. And on and on and on. Your blood gases are off. And they on and on and on. After 1 month with wearing these, the Japanese were very compliant. After 1 month of wearing these, the same test that showed diabetes before that showed there was no diabetes. The liver enzymes were normal. So this was only done with just a piece of plastic in the back of the mouth. Now I'm going to tell you why that worked after I tell you one more negative story. Then I'm done. I forgot about this slide. World War II. I think you've all seen Pearl Harbor, the movie Pearl Harbor. Some of you may have been alive back then, and saw pictures of it in the theater like I did. But the pilots didn't have any pressurized cabins back in those days. When they went into a steep dive bomb, if they had anything wrong in the mouth, they built up pressure in their teeth, and the pain would be so great they couldn't carry their mission out. So at that time, the military, the Air Force didn't have a dental program of any significance to screen out the bad teeth of people. And we had, many of you remember relatives, if you didn't remember yourselves, a few of you probably had relatives that went into the war that didn't have time to fix their teeth. They just went into the war and went through basic training and went to fight. And so consequently, we had a lot of people flying airplanes with bad teeth. And these pilots would get extreme pain when they'd go into a dive bomb approach. Well, they put these pilots to sleep, took molds of their mouth, put them to sleep, and pulled all their teeth at one time, and put false teeth in at one time, called immediate dentures. That's when immediate dentures were developed. And they put the pilots back in the air. The second day, they were back in the air. It's amazing that much surgery, they could be back in the air with the denture in their mouth. They followed these pilots that got those kind of immediate dentures, and they lived 10 years less than the ones that did not. They're pretty much all dead now. But that's just some statistics to show you that what I'm saying here is just not blown out of proportion. This is real stuff, and it happened to real people. If I have any ability is to bring information from various directions and bring it to a central focus. Now I'm going to put on my embryology hat and give you a 10-course study in embryology that would take a year to study in medical school. I'm going to make it so simple that everybody can understand it. Egg and sperm meets. The ovum starts to form, it's called a zygote when it's fertilized. Epidermal thickening, the part that hangs down, is called the neural tube. That forms your central nervous system. That means most of your brain, your spinal cord, and the 10 cranial nerves. The part that sticks up, the neural crest, forms the rest of the nervous system that goes out in your arms and legs, okay? Now, if you take the neural tube, the part that hangs down, as I said, brain, spinal cord, and the central nervous system, it forms one half of the master pituitary gland, and it forms all of the thalamus and all of the hypothalamus. The thalamus is the master computer of your brain. Almost half or more than half of everything that goes on in your brain is processed through the thalamus. And then the hypothalamus is a subdivision of the thalamus that has to do with stress. Then some of the forebrain. These white things here are considered dental structures, folks. Mid-nose, upper lip, premaxilla, that's the front part of the bone up here that holds the front teeth. The base of the nose. So if your nose is a little narrow and pinched together, you have a narrow premaxilla, which most of you in this room do. If it's wide, like the black gentleman over here, wider, he doesn't have a pinched up premaxilla. Now, and the four front teeth come out of the neural tube. Now, did you just hear me? I said your front teeth are nerve generated. They come out of the same tissue as your cranial nerves. You have 10 cranial nerves. Your four front teeth are, except the enamel, are extensions of your cranial nerves. Now, this is known for 50, 60, 70 years, but is not taught. And I'll tell you why in a minute. Now we come over to neural crest tissue. Now this can, all your receptors, your eyes, your ears, your smell, your taste, and all of that comes out of the neural crest, the part of the little embryo that sticks up, as well as the other half of the pituitary gland and all of your hormonal glands, including your pancreas that's causing the problem with blood sugar problems in diabetes, and your liver that you talked about, and your allergies that you talked about, and on and on. It's all hormonal gland problems. And medical doctors have specialists in this area, and they don't teach this stuff to them. The balance of the back teeth, except the enamel, grow out of the neural crest. So, folks, your dentist should be a neurologist of the highest order, and they don't know about it because it isn't taught. So don't be mad at your dentist. It's the system that's bad. The system. Because my teacher wanted to take this into the dental schools, and he went to the dental schools with it when Dr. Fonder wrote this information years ago and compiled it, took it into the dental schools, and they said, my God, whoa, that is something. And he compiled it onto existing books, a lot of it. Plus he did 10,000 case studies. But when they looked at it, they said, wow, that makes the dentist in charge of the body health, doesn't it? We don't want that. The medical doctors would be really upset with us. They think we're molar mechanics, and that's where we should be. So they didn't do anything. Go to talk to medical doctors. Went to medical doctors, and they looked at his stuff, and they said, wow, that's pretty impressive, but we don't know anything about the oral cavity. You go back to the dentist. So what I'm teaching you now is dropped in the medical dental crack. So, and the problem you're going to have is that this is the most frustrating part of the whole thing I teach is because when you're done, the number one question is, where do I find a dentist? And that's a frustrating thing because the dentists aren't trained there. So, summary, neural crest, the part that sticks up, gathers information. And the part that hangs down tells the body what to do about it. That's a summary of, and now you got Neurology Course 101. Now we go back to neurology and proprioception now. Proprioception is the way your body protects itself in its environment. So proprioception is the main gathering information center for the main computer of the brain called the thalamus, which tells the cerebral cortex, the thinking part of the brain, what to do. Comes from proprioception. This work was done, now I'm back into neurology now. This work was done by Penfield and Rasmussen in a book published in 1950 called The Cerebral Cortex of Man. It's in by Macmillan. It's in the McGill University, in the archives of McGill University in Canada, if you want to go dig it out of there. This book has just been ignored. It's put away. But he and his students traced, by the way, he wrote 20-some textbooks that were used in medical school and dental school and chiropractic school for years as the textbook for neurology. And he traced the brain back to the oral cavity over 50% of the time. Chinese told us that, but we now have scientific proof of one of the leading neurologists that what the Chinese said is true. So consequently, shortly after this work was discovered, the rest of the dental world again threw up their hands. We don't want anything to do with that. I mean, that you're getting way too much into how the body functions for we dentists. We don't want any part of that. Folks, you better know what your dentist is going to do with these teeth here when they are extensions of your brain. You better know and you better care, because if they don't know, you better know, and so you can tell them what it is you want them to do. Because I don't want anybody cutting away a piece of my brain or pulling it out of there because it had a little hole in the side and they said they couldn't fix it, or it broke off and they couldn't fix it, or whatever. Or it's got an amalgam filling in it, we better pull it. Or it's got a root canal, we better pull it. Would you let somebody just take away a little piece of your brain because they thought it had a little speck of mercury in there? I don't think so. These are extensions of your brain and spinal cord, folks. Don't ever forget it. And many of you are in trouble now. I'm going to tell you how to get out of trouble, so don't panic. I'm not a fear monger. I don't believe in instilling fear and not giving solutions. But the only way to overcome fear is by education. This is just part of the neurology. Look at the mandibular nerve. Look where it goes. Clear back up here, branches to the ear. Look at the maxillary nerve to the eye, head, forehead. So you got eye problems, you got ear problems, you got headache problems. Look in the mouth. Look in the mouth. That's where it starts. Again, I'm taking you back now to neurology. Proprioception sends a signal to the master computer of the body. The master computer says, okay, cerebellum, this is what I'm telling you to do. You better tighten up those muscles over there and get things. And so consequently, when I look over here and I see your face asymmetric on your left side, your left back, Mary, on the left side, I know the muscles have done that to you over the period of years, and it could have happened. We're going to show you when it happens. It's not the dentist's fault most of the time. And most of the time I'll tell you why. But now we have a posture problem. So chiropractors in the room, when you see a posture problem, you have a dental problem. You have a relationship of the lower jaw to the skull. Can you do something about that? Temporarily, yep. But you know what? When they chew their food, it's probably going to come back. And the number one thing I learned when working with chiropractors is that patient retention is tough, because results are there and then they're gone. And the pain keeps coming back. I know I'm not going to do a survey because maybe we should do a survey. How many people have gone to chiropractors in the room? How many have gone to more than one chiropractor in a room? See? You've gone there because the first one, well, I suppose they could have died or moved, but many of you go to a different one because the results you quit getting results. I see some nods.
How many chiropractors are in there?
One. But you see where I'm coming from is that, and no, it's no different in dentistry, folks. I did a survey on why patients leave dental practices back when I was practicing preventive dentistry. 50% of all patients move from one practitioner to another on a regular basis. 50%. Now, those of you that think in the medical world that think you don't lose patients, you're just mistaken. The patients do move. They move around, and they move around because they heard that somebody else might be better or something else, or they're dissatisfied for one reason or the other. But when you go over here, now the thalamus, I said its cousin here is the hypothalamus. That is a stress regulator. I told you earlier that I was going to talk about stress and tell you what stress is. Stress is not traffic jams. It is not floods. That can be stress. But the biggest stressor you have is an ongoing stressor of the relationship of your lower jaw to your upper skull. That is an ongoing built-in stressor. So you have all the symptoms of stress, and many of you have no external stress. I mean, you know where you're going to sleep tonight, you know you got a job, you got food, you got shelter. That's stress. Compared to our forefathers, you don't have any idea what stress is. A little traffic jam is nothing compared to crossing from Pennsylvania to Nebraska like my forefathers did in a covered wagon and burying loved ones along the way, not knowing whether they had water, food, or shelter, and not whether they're going to be attacked by Native Americans or not and killed. That's stress. You don't know what stress is. You don't have any stress, but because medical doctors couldn't answer the questions in this country of why we were so sick, they blamed it on distress. It's a nebulous disorder up here that, well, you got stress. Well, you have the symptoms of stress because they can measure those, but you don't have the causes of stress. But all of you do have the cause of stress. It's called the oral cavity. So here's what happens. This is out of the Grey's Anatomy. I think they won the award last year for their TV program. I wish they'd teach some of this on there some night. The mandibular nerve, also called the trigeminal or the fifth cranial nerve, is the only nerve in the body that is both motor and sensory. Now what that says, I said, remember the neural crest and the neural tube. The part that sticks up gathers information from all your different sensory, eyes, ears, nose, whatever, smell. The part that hangs down carries that out. The only nerve in the body that gathers and carries it out both is the mandibular nerve. The mandibular nerve has direct connecting fibers to the vagus nerve. Direct. The vagus nerve is what runs your ovaries, your pancreas, your testicles, your erections, guys, premature menopause, spontaneous abortions. That's run by the vagus nerve. Indigestion, not handling your food right, all vagus nerve. Directly connected to the mandibular nerve. Only nerve in the body that's both motor and sensory. I didn't develop this, folks. I'm just the messenger. This is out of a 55-year-old book, Grey's Anatomy, which is, I don't know whether it's still used in medical and dental schools or not, but it's the one we used. Again, take a look at the cross section. Cerebrum, cerebellum, brainstem. Look at your brainstem. Comes right up here. Comes right up here, becomes part of the mandibular nerve. The most important part of the whole brain that regulates the whole thing comes out of the, right here, the back of the neck, goes right up in the brain into the pons and develops into the trigeminal ganglia and right up on into the trigeminal nerve. This is in the books. And you let somebody cut away at it or take it out because somebody thought you had a mercury filling in there? if you had a little speck of mercury in your brain, would you have your brain removed? I mean, it's ridiculous, and I was one of them. I was one of them. A holistic dentist, and I got so disturbed and disgusted with them that they would not listen that I quit. Now, folks, I don't know about you, but I don't want this muscle tightening up on this blood flow to my brain. It's a no-brainer. If you put a blood pressure cuff on your arm, you reduce blood flow to the hand. If you have a tight muscle in this area, you reduce blood flow to the brain. Did I touch your muscle for you? Mm-hmm. Yeah, and she's touching it again now to see if it's still.
I can see you light on it.
Yeah, and so consequently, the muscles, there's 68 pair of these muscles, and they tighten up. The only way I know of releasing them, short of complicated stuff, is with this instrument. Not a stimulating instrument, but this one. This will relieve a tight muscle in 6 to 8 breaths. So the number one thing to do when you have faulty proprioceptive feedback to the brain is apply the laser on a daily basis. You can't borrow your neighbors because they need it too. So this is the problem, is they want to stretch their dollar because they're not sure these things work, so they want to all use moms or all use dads. Well, that doesn't work, folks. This is something that you should use every single day. How do you know when to use it? Touch the muscles. If you want good blood flow to your brain, Bill, and get good blood flow and oxygen to the brain, you got to release these muscles. Why do we have an increase in Alzheimer's today over when I was a kid? We didn't even know the disease when I was a kid. We had a couple old timers that were a little forgetful, but everybody knew where they were. They weren't lost. And they were still working and functioning. We didn't have Alzheimer's. We didn't have any of the diseases we have today. Because what's happened is that as you get older, your teeth get shorter. And here's what happens. I'll show you. And I had some people ask about hearing. Okay? Now, common sense goes a long way, folks. I'm an old farm boy, and I'm grateful for that because I learned common sense. This jaw, these teeth stick out this way, the upper teeth, and the lower teeth come this way. If you lose this posterior support, what do you think is going to happen up here? These front teeth are going to bang harder, are they not? So if you lose the back teeth, front teeth up here, lower front teeth here, my thumbs representing the back teeth. We've got a bite like this. We lose height to the back teeth, and you got a bite like this. Collapses. And when it collapses, it shoves this jaw joint up and back. That's the ear hole, folks, the auditory meatus. Up in back of here, right in that groove there, is where the venous drainage comes from the brain. So not only have you screwed yourself up with the muscles getting blood flow to the brain, you got a stasis in the brain now of blood getting back out of there, called a stroke. And so when the mandible is shoved up and back, you are at risk of a lot of bad things going on. And so consequently, it's regulated by the height of these teeth. Not necessarily, if you don't have them, that's bad enough. But if you have them and they're too short, it's just as bad. So the height of the back teeth, and they always get shorter as you get older, Bill. Doesn't matter what kind of dentistry you had, because every single dentist makes the crowns they put in shorter than the ones previous to that. Somebody had a question back here?
Hands up back there.
Okay, this gets people going, I know it.
Here, go ahead.
Could you just explain what is TMJ? What?
TMJ, that's a good point. This is the jaw joint. This is the temporal bone. This is the mandible. So this is the temporal mandibular joint. That term got locked onto us many years ago. And even the orthodox dentists today, the American Dental Association says there's no such thing as TMJ. But you still call it that. It's kind of like not saying the word ain't. It's now in the dictionary. Because people got in pain and they assumed it to be joint pain. No, it's muscle pain. So it's now the new word is TMD, temporal mandibular dysfunction. So this mandible is dysfunctioning in relationship to this temporal bone. The joint is an innocent bystander. It's just there. Can you get a bad joint eventually? Yeah, if you stay with it for a long enough period of time, you can. And again, in the chiropractic world, I get upset because chiropractors are consistently saying, I'm fixing the TMJ joint. No, they're not fixing the TMJ joint. What they're doing is they're releasing some tight muscles that are drawing the jaw up and back. But because the jaw is regulated by these hard things here, the hardest substance in the body called teeth, you can adjust all you want to. And when you bite together, it goes right back where it was. And so consequently, your bite is what's called acquired bite. Everybody's got a bite. Somebody says, well, my bite's off. Well, everybody's got a bite, and it's acquired. But guess what? You can have a bite where this set of muscles over here is much tighter than this set over here, which I did. That's why this side of my face is different size than this side. You can see that, I think, can you not? If you look, take my glasses off, straight down the middle, I have an asymmetry in that this side of the face is smaller. How did it get smaller? I wasn't born that way. It got smaller because these muscles got tighter. Yours are on your left, yours are on your left, yours are on your left. So most of the time it's left. In my case it was right. So took me a long time to realize this. And it is the key factor, and here's why. I'm going to teach you why this is so important. And again, I want to tell you why I'm teaching it. Why I'm teaching it is that the main way of treating it's right here in my hand. This is the way to treat it. Do any of you remember high school biology where did any of you work on frog muscles? Anybody? When you stimulated the frog muscle, what does a muscle do when it's stimulated? Twitches. For gosh sakes, we don't want muscles to twitch up here. We want to release them. Would you want to stimulate that? It's the dumbest thing I ever heard of. We got people stimulating these muscles. We got people putting high-powered lasers on them. These muscles should not be stimulated. They should be released. They should be relaxed with a low-power laser. Massage will relax it for a little while. Laying on of hands is better than a stimulating instrument. So consequently, when you have a situation like this where I put this picture on to show you that the upper jaw, as you lose teeth, gets smaller. So the upper jaw is shaped like this, sloped this way. The base of my hands being the teeth down here. As you lose teeth, it gets smaller. The lower jaw is shaped like this. As you lose teeth, it gets bigger. So as you lose height of teeth, just height of teeth, then the upper jaw gets smaller and the lower jaw gets bigger, and you have no more, and do not have a friendly relationship between the lower and the upper skull. And when you have that, then the only way you can exist is through having the muscles do what should be done by a relationship. And so what you end up having then is a constant tightness of these muscles. Because the proprioception, now I'm going to bounce back and forth between anatomy and physiology and neurology here. These teeth here The most delicate proprioception embryologically is between the front teeth. When they touch, it's like I touch this bulb and I jerk my finger back right now. So when your front teeth touch, the muscles say, oh, not supposed to happen, jerk her back. And so the muscles tighten up to pull it back. Or if you start to close and you touch what's called an inclined plane. Now to explain that, the upper teeth have a tip and they're supposed to fit in a valley down below. Like that, like a gear. But when you lose height and this upper jaw gets smaller and the lower jaw gets bigger, your gears don't fit anymore. And so what happens when you start to close your mouth, you hit on an inclined plane and then it slides. When it slides, these muscles tighten up. When they tighten up, they reduce blood flow to the brain. When they tighten up, they send a faulty signal to the brain. And here's how that affects you. So we come back to this guy here, showing that as the upper teeth lose height, they get narrower. Lowers get wider. Okay? So then we come back to what is proprioception. Proprioception then, that's the signal system between your upper and lower front teeth and the first premolars, the ones right behind the eye teeth. That's what controls your autonomic and nervous system, which is composed of sympathetic and parasympathetic. So we have two divisions of the autonomic nervous system. The autonomic nervous system regulates your entire organ function. The way your heart beats, the way your lungs breathe, the way every bit of your internal organs function, all the way down to your sphincter muscle and your rectum to the erection of your penis, is all regulated by the autonomic nervous system parasympathetic division. Okay? Medicine wants to treat this with, when we have a underactive parasympathetic, medicine wants to treat it with drugs. Nutritional people want to treat it with supplements. Homeopathic people want to treat it with remedies. All of them want to reduce stress that they interpret to be external. Take a vacation. Go lay on the beach. Get away from that stressful job you've got. Get away from that stressful husband or wife. Take a rest. Or some want to treat it with different types of other cultural things like Reiki, Tai Chi and stuff, which is probably the best of all, if you want to do that. Or the other way of treating it is take a look at what happens when you stimulate the sympathetic. Now remember, the sympathetic is the front teeth hitting too soon. They're only supposed to hit when you shove your jaw forward. They're not supposed to hit when you bite straight up in the middle. If they hit too soon, this is what happens. Isn't this what's wrong with America today? This is exactly what's wrong. Exactly what's wrong. Stress, blood pressure, heart rate, breathing problems, and glandular problems. That's what happens when you activate the sympathetic system. On the other hand, if you activate the parasympathetic, it just reverses that. So you activate the parasympathetic, you reduce stress, you reduce blood pressure, reduce heart rate, you slow the breathing, and you increase all the function of the internal organs. This is what you want. But that's because the parasympathetic isn't stimulated. Remember the chart I had earlier, I'll come back to it. The parasympathetic is regulated by the height of your back teeth, or whether you have back teeth or not. Here's a graphic. This is where America's at. This is why we are so sick and why we're 41 in longevity. It's not because we're not spending enough money. It's not because of our water. It's not because of our soil. It's not because of all the things we've been told us about. It's because we have a sympathetic dominance. And it's not because of external stress. It's because of internal stress called dental distress. Now, medicine wants to give drugs, vitamins, homeopathic remedies, and all these things to bring this down. Would it not make more sense to bring this up? Bring it up. How do you bring it up? Raise the height of the back teeth. That's how you bring it up. So when we're dealing with, again, with the way this system works, here it is. The way this system works, all of these internal organs here are connected to the parasympathetic. It's not run entirely by the vagus nerve, but a significant impact by the vagus nerve. And remember, the vagus nerve is directly connected to the mandibular nerve. So when you're looking at all the problems, pick your problem. Pick your poison. You got a stomach problem, you got a bladder problem, you got a gut problem, you got a pancreas problem, you got a female or male problem, pick it out. Pick it out, and it's all answered in the basics of medicine, called embryology, basic physiology, go back to the way the cell forms. And when you go back to the way the cell forms, you'll have your answer. So then here's what, now I'm going to bounce back to China, 2,000 years ago. The Chinese said that this regulates that. Penfield and Rasmussen proved it by tracing neurology from the oral cavity, from the brain back to the oral cavity. Over here, here's a plug-in. There's a plug-in. There's a plug-in there, and there's one there and one there and there. I used to do a little electrical stuff way years ago, and I can wire a house. That's called a circuit. And the body's called a meridian. In this room, we have 6 outlets on this circuit. If we go back in the closet back here, you find a junction box that has a little breaker on there that's got a 15 amp breaker. You ladies know if this box goes out here, you don't go to the box and start operating on the box. You don't start cutting it out or giving it some type of a supplement or giving it some type of medicine. You go back to the closet and look at the breaker switch. If the breaker switch is off, you throw it on. If it goes off again, you've got a problem in the circuit. You see, if you make it that simple, medicine wants to operate on that box. And they want to take care of the symptom of that box. The problem is back here in the janitor closet, and the Chinese have told us it is here. Penfield and Rasmussen says it is here. Dentistry doesn't want the job. It's an awesome responsibility. I don't blame dentists for not wanting it. Once they know this, you cannot unknow what you now know. And once you know this, it's an awesome responsibility to someone come in and they're walking in like this and they got heart palpitations and they can't breathe very well, getting into your chair and they want one tooth filled. It's an awesome responsibility. What are you going to do? Say, fill their tooth and watch them walk off and die? Or are you going to try to teach them that they could be healthier if they raised the height of all their teeth? And then you know what that person will say? Oh, that dentist just wants in my pocket. They're trying to rip me off. Folks, most of you created your own problems because you're too cheap to have good dentistry done. Some dentists are not willing to deliver it or don't know how to deliver it. Most of you are putting your money in the wrong place. You're going to have a new car, a new refrigerator, a new vacation, whatever it is, rather than take care of this because you didn't know it. You thought, I can chew fine if I lose a tooth or two. I don't have a problem. Mary, you can chew just as well as before you lost that tooth, probably. Close to as well. You'll learn to. So it isn't chewing. It's the signal system that's out of whack. Remember, this side is stress related, sympathetic. This side is parasympathetic, gut organ related. So when you have problems in the gut or organ glandular area, you must look at the height of the back teeth. You must. Now, can you get results without doing that with the laser? Sure. Because you know what the laser does? The laser will release those muscles and will let blood flow back to the brain. And when the muscles are released, until you chew your food again, you're okay. And so consequently, I carry this thing with me all the time. If these muscles get tight, I put it on. And if they're tight twice a day, I'd put it on twice a day. Because it only takes a little bit, and to put it on there, 6 breaths, they're released. The amount of energy you're putting in is very minimal amount of energy, very minimal. So that's what we want to do is do this. That's our goal. And then when we do that, we end up putting people in homeostasis. Remember, I started with this slide way early this morning, and I said I'm going to come full circle. We go homeostasis, which is a harmonizing effort of the way the body functions in harmony. It's maintained by an energy transfer between the frequency of your consciousness, the way your lower jaw fits to the skull, and the energy and the matter. That's what we mean by homeostasis. But you test your muscles. That's the lateral pterygoid. That's the medial pterygoid. If they're sore, you've got reduced blood flow to the brain, and you need Miracle Bite tabs or Easy Adjust proprioceptive guides. This is the proprioceptive point that we always laser. Here's just an example of a person who's got problems. You can see this face squeezed up on this side. This woman is still a beautiful lady, but she was a trim lady until her proprioception went haywire, and her organ system got all out of balance, and her thyroid quit functioning properly. Her basal metabolism went off, and she started gaining weight, had premature menopause, all sorts of problems. This is the most perplexing part of what I teach, because there's not a one of you in this room that doesn't affect. When I ran into this problem years ago, my teacher, Dr. Fonder, was building the height of the back teeth up. And let me show you that picture. I think if this doesn't blow you away, particularly you people that are into taking the mercury fillings out and type of thing. 39, this is 55-year-old picture. So what I'm teaching you is not new. Look at this man's head position. Is it Gary?
Sure.
Chuck?
Sure.
Look at his head position. High shoulder. Look at the length of the hands. This leg's going to be short. You'd say, man, we need to adjust him. And I would agree. Look at the forward head position. That's 14, 15, 16 pounds. Now hanging forward this way. Tightening the muscles up that control the blood flow to the brain even more. And if you just think for a moment with me and think that I am the guard of the queen palace, and I'm standing this way. I can raise my feet and march. My head is over my shoulders. Now, think for me just a moment. The head comes forward. How high do you think I can raise my feet? Now you know why old people shuffle. And the reason the head comes forward is a life-preserving thing. It comes forward because when you lose the posterior support of your teeth, it closes your airway down. And the one thing you can't live without more than 7 minutes is air, oxygen. So when you are standing erect and tight like this, close your teeth together, you can't breathe. So your head comes forward so you can breathe. When you lose the posterior support, your head comes forward, Richard. And then that creates and aggravates the internal organ system, the parasympathetic, and then you have problems like you have, or I'm going to get after you again. Because I got him some bike tabs made, he doesn't wear them. And so Art doesn't. But nevertheless, this is a 50-some-year-old picture. So basically, what is the answer? The answer is, let's see, I've got to find it. The answer is to put something temporary. I didn't find the picture, so I'll just tell you. The answer is to put something temporary and to raise the height of the back teeth. That's the answer. When my teacher first used to build those up, and he would build them up with anything. That guy in this picture here, you know how straight he is there? You know what Dr. Fonder did? He drilled his mercury fillings out. He had a bunch of them in the back of the mouth. He drilled the mercury fillings out and placed higher mercury fillings. Just raised the height up with mercury. That's all he had to work with. So when our American mentality to be in charge, the medical system wants to be in charge. They don't want to put the responsibility where it belongs with you. They want to be in charge. And so when they understood from the Chinese the problem was that the meridian system was screwed up because of the height of the back teeth, they didn't read that into it. What they said is the meridian system is screwed up because of the teeth. So you have a chart passed out now, and it lists the teeth. I'm telling you that chart is an American mistake. It's an American mistake. Because what it does is list the teeth as the faulty proprioceptor thing, and therefore your dentist says, see, I told you we ought to get those mercury fillings out. See, they're the ones that have caused your pancreatic or your liver problem or your heart problem or whatever. Get the mercury fillings out. But you know what? Take them out, you don't get it better. But then they say, oh, it's the root canals. You got infected root canal. You better get the root canals out. No. Those are mistakes. Because the height of the back teeth is the problem. When you take your mercury fillings out and put in new composite fillings, who's had that done? In every single case, the fillings are shorter than they were before.
Yes.
Every single case. Doesn't matter how good your dentist is. The fillings are shorter than they were before they took them out.
Why?
Because you can't make them higher because the tooth gets sore in the abscess. So you
How
make
high
them lower.
should they be made?
How
You
high-
have them done,
I
like
didn't-
how many, how much height should be added? Is that individual?
No,
or is
that's
that-
individual. What's necessary is put the
Like
muscle in
naturally-
homeostasis. And what's homeostasis? It could be, no, your friend didn't come back. No, you did. I'm sorry, I was trying to get, last night, we talked about this last night, and I used that little stick of wood for demonstrations. And you called me some time ago and said about, was it your son or a patient or a friend?
Son-in-law.
Son-in-law. And he said, I did what you told me to do, and we didn't get results. And I said, well, maybe put 2 sticks of wood in. Tell him what happened when you put 2 sticks of wood. Right away, got results. So, obviously, he was quite a bit overclosed. 2 sticks of wood gave immediate results. Remember the Japanese put 10 millimeters high in there. That's a bunch. I don't know if everybody needs 10 millimeters. You need what you need. How do you know what you need? That's the harder part. It's easy to get you in a state of homeostasis. It's hard to make it permanent. And you gotta be willing to spend some money for this. You better spend it there than in the cardiac ward or the cancer ward.